Now, why are we considering this common topic, diabetes, in today's scenario? Let me put to you in a perspective why this topic is important. So, as you know, diabetes is the most common chronic problem worldwide. And why is important from the Indian perspective? We are now the most populous nation at this particular juncture. So, the rough prevalence in India for diabetic patients is around 10%. So, when you're talking about 145 crore population, and if 10% at a given period of time have diabetes, that is like 14.5 crore population at a given period of time is affected by diabetes. You must understand the gravity of that situation and the problems it imposes on the healthcare spectrum. So the hospitals will have a grave burden associated with the control of this diabetes. Now, why do I have to discuss diabetes? If you ask me, that diabetes is not just a problem of insulin control or just popping some sugar medications. The issue with diabetes is basically it is a multi-organ disorder. So the problem with diabetes is it starts with the pancreas. Basically, whenever we talk about diabetes, there's a problem with insulin secretion. So we take some medications. So as this is the problem with diabetes, is that it is a multi-organ disorder. So it starts with the pancreas. So when it starts with pancreas, there is a decreased insulin secretion, and we try to control our sugars by taking some medicines that are associated with sugar control. Next slide, please. So, as I was talking, diabetes is a metabolic problem. So, not only one organ system is affected, multiple organ systems are affected during the course of the time. So, why we are going to discuss this problem? Because this is a problem that not only affects the pancreas, it may affect your eye, your vision, it may affect your kidney, it may affect your nerves, it may affect your heart, it may affect any blood vessel in your limbs, and it may cause some issues with the brain. So that is why we are taking on this common topic, because the burden of diabetes in a population which we consider India the most populous country now is too huge for a public health system or a private healthcare system to handle. So that's why it is necessary, not only as churchgoers, but as common citizens, to understand this problem and to consider curtailing this problem at the initial stage so as to land in complications. Next slide, please. Okay, as I was talking, at this present juncture, we have around 77 million diabetics in India itself. And the projection is that around 2045, we'll have around 134 million people affected by diabetics. Now, what is the problem with this disease is we diagnose it very late. The problem is we don't take into account mild symptoms of diabetes, like we drink plenty of water, or we go to urinate frequently, or we are excessively hungry. So these symptoms, we consider it as a part of a daily routine and ignore it. And the present data in India states that nearly 57% of the diabetics were detected at a very late stage with some organ issues. So the problem lies here is in our awareness to conduct routine health checkups. So I won't say that considering our work problems, our daily routines, it is not possible to go for a monthly or a 3-monthly or a quarterly checkup. I always advise my patients, my well-wishers, and the people I know, at least do an annual blood checkup. Make it a point to do an annual health checkup as a part of your employment or as a part of your daily routine. Once in a year, you should do certain basic tests, especially sugar, urine routine and creatinine. I will tell to you why I am talking about all these things in the subsequent slides. Next slide, please. Okay, this is the world map showing diabetes. As you see that India is shaded in a yellow color, that really is around 10% of the population. We do not come to the level of America where it is 15 to 20% of the population may be affected by diabetes. But you should put in a perspective that we are the most populous country, and out of that 10% at a given period of time is diabetic. Considering to the density of population in America, where 15% is a manageable issue. So this is why it's a public health problem rather than a common health problem. Because when you come with complications, I being a nephrologist, my majority of the kidney disease patients are diabetics default. So at a given period of time, if you ask me which patients do I deal with the most due to a chronic kidney disease, it's basically 70% will be diabetics default. There is no question otherwise asked. Why? Because our general perception of handling diabetes is skewed. We think that medication itself solves the problem, while it is not so. That is the purview of taking this lecture, that not only medicines, something else associated with medicines that you need to screen and you need to make it as a part of your daily life patterns. Next slide, please. So what are the things I aim to cover in this topic is basically what are the major issues. So what we as doctors classify is something which is strikingly possible due to diabetes and something which is commonly associated with diabetes. What is strikingly associated with diabetes is complication associated with the eye, complication associated with the nerves, and a complication associated with the kidney. These are the striking complications associated with poor control of your sugars. And three other things which are commonly associated is diabetic patients have more incidence of getting a myocardial infarction or a heart attack in your terms. They have more possibilities of getting a stroke, and they have more possibilities of getting something called as peripheral arterial disease, that means blockage of the blood vessels in your lower limbs. So this is the most common association, but striking associations are the eye, the nerves, and the kidney. Next slide, please. So let me start with the eye. So I have a pictorial representation of something which is the normal eye, and on your right eye is called as a diabetic eye. So the most common symptoms that when we encounter in diabetes is blurring of vision, which is otherwise unexplained, and some half vision. Only you will be able to see on one side or the other side is blurred. And sometimes very catastrophically, you will have complete loss of vision. So what do I mean by complete loss of vision is suddenly you are doing something and you are not able to see at all in one eye. Diabetic people, what we say is you should have an annual eye checkup, because when I say complete loss of vision due to diabetes, you have blood in the eye. So you have something called as vitreous hemorrhage, that means bleeding from the small blood vessels in the eye. That is a part called as proliferative diabetic retinopathy. It is too catastrophic because you cannot regain your vision unless you have got a severe vitreous hemorrhage. That is the problem with diabetes. Diabetes is actually a very slow, indolent killer. So the changes are so minute, if detected early only, you can address that problem. So these are some changes which take place in the eye, where blood supply to the retina, that is the back portion of the eye, is initially affected. Blood supply is compromised. Then the blood vessels become leaky, and then blood starts oozing. So these are the things. So we need to address a particular problem prior to the oozing stage. So this is very much important when you're dealing with changes of the eye. So the recommendation from the doctors or from the eye doctors is definitely have an annual checkup of the eye, especially who have a long history of diabetes. Next slide, please. So how do you address the problem? Everything boils to strict sugar control. And as I said, an annual eye checkup. When you have severe cases, you will have something called as laser therapy and some injections. But when you go to that stage, actually, it's a point of no return. So once you have come to this particular stage, you actually will have some loss of vision at all, which cannot be corrected. These are only corrective measures. So as doctors, what we try is prevent this complication from happening rather than curing the complication. Next slide. Now something which is associated with the nerves. Okay. So diabetic people have lot of nerve issues which we always ignore. So every diabetic patient, especially elderly people, when they get diabetes, they are bound to ignore these symptoms, because as the elderly perspective is there, I am aged, so I have this problem. But actually, it is a problem which you can actually control at the initial stages. What are the problems you will face? First and foremost, you will develop numbness in the sole of the foot or in the hands. Sometimes you will start losing balance while walking. Sometimes you are not able to stand. Sometimes you will have muscle cramps, which is otherwise unexplained. And sometimes you lost perception of hot and cold. For example, you are having a hot tea. Whenever you touch that hot cup, you are not able to feel it. These are the early warning signs that diabetes has taken a toll on your nerves. So this is for the elderly people who are around there, not only elderly, even the young people. So please do not ignore these warning symptoms. You may think it is a subtle thing, but once it progresses beyond your control, you will have life-afflicting disorders. What do I mean by that is, you will not be able to do your daily activities, your routine activities. So these are the initial things which you should bear in mind while dealing with diabetes. Next. So if you start developing these symptoms, definitely consult a neurologist. He will see certain modifications in your life. He will assess your muscle strength. He will assess your nerve issues, give certain medications. That is one part. When people develop these symptoms, they have to be very worried about the slippers they use. Actually, you have some diabetic footwear that you need to take into account when you develop numbness and loss of sensation on the soles of the foot. What is the problem why I advise a diabetic footwear is, you do not perceive an obvious injury. For example, if you are going barefoot, if you have a nerve problem due to diabetes, even a small trivial injury on the soles of the foot, you will not perceive. And once you not perceive that, it becomes an ulcer and becomes infected. And as you all should be aware, diabetic patients have a low immunity and they take time to heal. So the best way is to prevent such an injury happening rather than facing the complication of the injury happening. So this is one of the foremost things when I discuss with my diabetic patients or also my kidney patients, is please be aware of these symptoms. Small numbness, difficulty to perceive a position, gait instability, that is while walking you are not able to maintain balance, difficulty in differentiating between hot and cold, shooting pains in your lower limbs, muscle cramps that are otherwise unexplained. These are warning signs that diabetes has taken a toll on your nerves. Next slide. Okay, now this is my part. So I come to the kidney, so I'm a nephrologist. And why diabetic nephropathy, or that is diabetic associated kidney disease, is important, I will tell you. From my perspective, we have chronic kidney disease increasing at the ratio of 1:5 in the population. And diabetes contributes to nearly 70% of the population. It is in the recent 5 to 6 years which I have been doing my practice, I have been observing that lot of patients are very much ignorant that they have a kidney problem. And they come to me in a stage where I can only offer them dialysis or renal transplant. So this actually is a difficult thing. Why? Because you don't have a large number of dialysis centers, a large doctor population or a dialysis technician population to cater to the needs of these people. People have to run helter-skelter just to get an appointment with a nephrologist or to cater to their needs. And that is a preventable thing. Why I say it's a preventable thing, and that is where I will emphasize certain blood and urine tests that you should do periodically on an annual basis. Not monthly, not quarterly, not 6 monthly, no. Just yearly base, you just do something. If you are diabetic, or even if you think your sugars are well controlled, it has nothing associated with your eye, nerves and your kidney. Because a tight glycemic control does not guarantee you that you won't develop these complications. This is one thing I want to emphasize today, because everyone who comes to me always tells me, sir, I have done a good sugar control, then why did I develop a kidney problem? That is because diabetes is not only a problem with sugar, it's a problem with other organs also. So a tight sugar control will go a step to prevent the complications, but it does not guarantee you that these complications don't happen. So this is one thing I want to emphasize on this day. So how do we go about to detect a kidney problem associated with diabetes? Next slide, please. So the thing what we emphasize is once in a year, do a blood test called as creatinine urea and do a urine complete examination. Now urea creatinine is a very late indicator of kidney disease, but what is an early indicator of a kidney disease is protein leakage in your urine. So this is the earliest stages when you say before your creatinine or your kidney function becomes abnormal, you will start developing protein leakage in your urine, and that is exactly the time you should meet your kidney doctor. Not when your kidney function has worsened or your renal functions has worsened. So I advise my diabetic patients as well as my patients who have chronic kidney disease also to do an annual checkup, and based on your kidney function I will ask for frequent checkups. But a patient who is perfectly normal in terms of appearance and in terms of well-being, but a diabetic patient, my recommendation and the worldwide recommendation is do an annual urine routine analysis, your sugar, your creatinine and urea. The problem why in Indian spectrum is increased, because diabetic kidney disease has increased, is due to two reasons predominantly, which is my observation and which is also the research observation, is lack of awareness among the patients. That is, you only perceive it as a disease of the sugar control is the only perceive, you do not think about other organs. Second thing is your dietary patterns. So especially predominantly when you're talking about South Indian population, we are laden with carbohydrates, left, right, center. And we do not keep a check on something called as glycemic index of food. So what we eat in plenty, and what we should control, we don't control. So that is not a problem with any person here. Each and every South Indian is bestowed with that gift not to control your diet. So this is the problem which we deal when we deal with diabetic patient. Second most important thing while dealing with kidney patients, that is my arena, is laxity on the patient's end to approach a super specialty doctor. So that may be due to inaccessibility in some areas, but at least the people here are accessible to many nephrologists or many kidney doctors. The approach of a general physician is totally different from an MD physician, from a super specialist. So for a general physician, due to cost constraints or due to the patient load, they just basically look into your sugar control. And they will look into your issues on a later date when you develop complication. But that outlook should change. So I would say it's a fault of the doctors and not the patients itself, because we have a huge chunk of population of diabetes that we have to deal. So we as doctors, even I also may be a part of it, that we do not systematically analyze the complications associated with diabetes and try to get a middle way out. And that is where we have faltered. And I would say doctors have played a role in contributing to the load of diabetes without analyzing or getting a full picture of diabetes. So this is partly our problem and partly your problem. So this is what has actually increased the problem of kidney disease in India. Why this is alarming? Because we cannot cater in another 40 years the load of kidney disease in our country. We don't have adequate facilities. We cannot have so many prospective nephrologists or dialysis technicians to cater to patients for dialysis. So that is a public health problem which will reflect poorly on the health status of the community and the country. So I would suggest prevent the problem, prevent the progression, so that you don't meet me in dialysis rather than I meet you in some earlier stages. So how do we go about the management of diabetes is the next thing which I want to deal with. Next. So diabetes, now I will go to the other spectrum, the commonly associated spectrum. So it is a very known fact that I told you diabetes is not just a problem of sugar control. So any patient who is diabetic default has 2 to 4 times risk of developing a heart attack default, because diabetes basically affects your quality of your blood vessels. Any artery, any vein can be affected by diabetes, and that is reflected with the most commonly associated problems, that's having a heart attack. Next slide, please. And the most commonly associated problem known as stroke. So any diabetic patient by default has 2 times more incidence of developing a heart attack, a stroke, or a peripheral arterial disease. That is means the blood vessels of your lower limbs are blocked. It is by default that you will have these diseases because you are diabetic. There are many pathophysiology associated with. I don't want to waste time. What I have come here is to emphasize the importance of this health problem. So just being diabetic, whatever is your sugar control, will just predispose you to 2 to 4 times of developing these complications. So this emphasizes the importance of this disease on the health strata. Next. Next slide. Okay. So this is a very beautiful diagram that is put by the American Diabetes Association and the Indian Diabetes Association. So it has various strata put like that. I'll just give you a brief idea of what we talk about when we deal with any diabetic patient. So basically we talk about, first is diet. Second is exercise or your physical activity. Third, if you are obese, then we talk about weight reduction. Fourth, we talk about smoking, and if you are alcoholic, we talk about alcohol abstinence. And then the fifth thing comes is medications. So if you do the 4 things perfectly right, then I will tell you the sugar medications are barely anything. If you don't do the 4 things perfectly right, then you have a big list of medications that you need to deal with. Next. Now the first thing, everyone worldwide, any diabetologist you go, you meet that diabetologist and come out, there will be a dietitian sitting outside with a big list of what to eat and what not to eat. I'll put you in a very simple thing. What do I mean by a diabetic diet? So does it mean that I don't eat rice? No. Does it mean I don't eat vegetables? No. The point is not about how much you eat. The point is how balanced you eat. Okay. So the thing, can I go to the next slide, please? Okay. So this is a very common slide. So there is something called as a dietary pattern called as DASH diet. Okay. So this is dietary advice to reduce systolic hypertension. So basically this diet is predominantly rich in vegetables, fruits, protein, and a balanced carbohydrate diet. So can you eat all the vegetables in diabetes? Yes. But if you have a kidney problem, you should ask me what vegetables I have to eat. But if you're just plainly diabetic, you can eat any vegetables as such. What is a problem with the Indian diet, which was a problem in the Western diet, which has transformed into the Indian diet, is the use of lot of processed food and preservatives with unnatural sweeteners. So even me and even the youngsters, we have a liking towards beverages, sodas and Mirinda, Coke, whatever you say. So we have a lot of liking towards it. Even when I was college, I must admit I liked a lot of beverages to keep me studying. So I will tell you that this is a very bad habit, okay, because they don't have natural sweeteners in them. They have unnatural preservatives that is used to increase sweet, and that is not metabolized by your body. Metabolized means broken down by your body, that contributes to your diabetic load. And when I talk about diet, I won't say that you don't eat this or you don't eat that. I would say you balance the diet. Means you don't eat a quantity of food which you intend to eat at a given period of time. So I mean, for example, if you have a habit of having 5 chapatis and you are diabetic, I would say you take your 2 chapatis now and probably an hour or 2 hours later, you have to have your 3 chapatis. Why I say so? Because when you eat all your 5 chapatis at a given period of time, your sugar level spikes up. At the same time, when you are distributing, your sugar level is stable and plateaus down. And at the same time, you don't get a surge of sugar, and you are able to fulfill your nutritional requirements. Because every individual, a lean person may have a different individual, an obese person or a heighted person will have a different nutritional requirement. So you have to what you call individualize your dietary regimen. So if a diabetic patient asks me whether any food I cannot take, I said avoid preserved foods, avoid processed foods, avoid foods with high glycemic index. Now what do I mean by high glycemic index? Is berries, this sodas, beverages. These are all food items with high glycemic index. Means those foods which will spike up your sugar within an hour of taking your food are those foods which have a high glycemic index. Those with low glycemic index are your vegetables which hardly spike up your sugar. These are, any vegetable is suitable for you. There is no choice that this cannot be taken or this can be taken. But once you develop a kidney problem, then there are certain restrictions. So now let me say the kidney problem, if there are any here. So when you have a kidney problem, you are supposed to avoid foods which are rich in potassium. So what are the foods which you will avoid? Is basically all the fruits except apple, guava and papaya. Why? Because their other fruits are very rich in potassium, and any kidney patient is not able to throw out the potassium. Why am I talking about high potassium diet? Is because potassium, if it is excess in your body, has a tendency to stop the heart. So anything which is excess in your body is not good for your body. Same thing when you are taking in patients who are having a kidney problem, they have to moderate the salt in the diet. So even patients who are diabetic who have an associated hypertension, the recommendation is only to take 5 grams of salt. Now everyone here will be amazed to how do I calculate these 5 grams of salt. Especially those with kidney problems, they ask me this question. Nowadays the world has advanced, so you get 1 gram sachets. So that would be a right time. But if you are asking me what is 5 gram of salt, I would say a gram of salt is half of a teaspoon. So that will be the measure for the ladies who are in charge of the cooking here. So that is how I would say you take a teaspoon, half of that teaspoon would be 1 gram of salt. And many of my diabetic patients ask me whether any particular salt substitute is a good option, whether any other sugar substitute is a good option. I would say none of the sugar substitutes are a good option. And there is no particular salt which is supposed to be superior. For example, Indup. I think many of the people will be there. It is rich in potassium, if you know, that is not good for the kidney patients. But they do ask me that, can I take Indup? I would say no. Because iodized Tata Namak or whatever Tata salt is good enough. Because you can actually maintain the amount of sodium chloride in those normal salts rather than the processed salts which have additional nutrients put in it to enhance the nutritional value. So I would say there is no particular salt which is superior, or there is no particular sugar substitute that is superior. So this is a big list. So a lot of vegetables are superior, as you say, but I would say avoid the processed foods, avoid that have preservatives, and avoid the jams, jellies and all which have preservatives. Next. So this is the basic recommendation which we give all diabetic patients here. You have to restrict the salt in the diet. That starts with 5 grams of salt. And why? Two things. Less of salt in diet is good. Why? Because you have a less tendency to develop blood pressure. On average, in our Indian diet, any Indian diet, be it a North Indian diet or South Indian diet, there's nothing, no difference in that. So you actually take around 10 grams of salt per day. And that is as good as you are taking a Western diet. We blame the Western people for eating a lot of non-vegetarian food. Neither are we good in that, because we put salt some way or the other in our diet. So average Indian diet, anywhere, be it Northeast, Southeast, Southern, Northern, Western, you are taking 8 to 10 grams of salt. And the challenge is actually to reduce salt in the diet. Because majority of the diabetic patients, 90% will have hypertension in their health background. Second is protein. Now, do any proteins cause a problem in general diabetics? No. The answer is a no for that. But if you have a kidney problem, then the issue changes. If you have a kidney problem, you are asked to restrict your proteins. Why? Because the kidney is one of that organ that is going to break down your proteins, and you don't want to give problem to a kidney is already ill. So that is the principle behind restricting your protein. But when my patients are a mixed bag actually. I have a lot of patients who come from the low socio-economic strata. The Western are very much rigid in restricting the protein in the diet. But I do not per se believe in that principle, because people who come from the low socio-economic strata are already compromised in their diet. If you emphasize to restrict protein, they will become malnourished and they will have more complications of disease. So what I would suggest is a very practical way. If you are having a kidney problem or you are having a heart problem, is to avoid red meat. That would be a very practical suggestion. Egg white is a very good source of protein that you can take. Egg white, I don't mean the yellow, the yolk at all. So I'm talking just about the egg white. It's a very good source of protein, a very high nutritional value protein. And if you want to have chicken and fish, I would suggest you can have it once in a week. But I would advise you strongly not to take red meat, because they are very rich in their lipid values or the cholesterol values. And that is one of the risk factors which will add to your already plight of diabetes. You will have increased risk of having a MI, that is a heart attack. You will have increased risk of developing a stroke, and you will have increased blockage of your blood vessels, thereby hampering your quality of life. Next slide, please. So exercise. Now many of the people, elderly, young, say, what is the optimal amount of exercise? I go to the gym, I slog for nearly 1 hour. Is that the norm? I am doing a good job. I say, if you can spare 1 hour, good and well. But I would say a minimum value, right? I have to look at all the age spectrums and tell you, okay, at least do this minimum, so that you can have the benefits. And the ADA recommends that you should have brisk walking for 30 minutes, 5 times a week. That is 150 minutes of brisk walking, not the usual walk which I see in my compound society. Everyone will be talking, discussing, walking in their own pace. Some may be walking really good, but some majority of them I have seen at that way. I just talk about brisk walking. Majority of the problems when I see is I talk to elderly population. The young people are agile, they will do the brisk walking, or they may go ahead and do much better. I encounter this problem especially with my kidney patients as well as my patients who are elderly, those who have crossed 60. I already have a heart problem, sir. I already have some gait instability, sir. I would just say, do your regular paced walking, means whatever is feasible for you for 30 minutes. I do not emphasize you start walking briskly and all, because when you have complications associated with diabetes, the ability to do exercise is limited. I agree with that. But I would say, whatever is feasible for you, do that for 30 minutes. So it may be walking at a gentle pace. Okay, do it for 30 minutes, because the ADA does not recommend what type of exercise you do in 30 minutes. It expects a minimum base of 30 minutes of brisk exercise, whatever is feasible for you. Then for patients who are overtly obese, I would say a weight reduction. So weight reduction, I would recommend it by a natural way, by exercising only. I do not advocate tablets or weight reduction surgeries. I am not a fan of that, because it entails its own complications. So I am a favorable person who say you exercise for a year and get your weight down, rather than you exercise or operate yourself and get your weight down in a month. Because whatever you do it naturally will reflect in a long term. What you try to attain in a fast way won't last for long. So what I always emphasize my patients, if he says, sir, I just lost a kg, I said, okay, you lost 1 kg, come after 10 kg loss in 1 or 2 years from now. That's fair enough. Because our body is not a robotic machine or an appliance. You must understand that. Even you adopt a weight reduction policy also in your way, your body cannot adapt to the metabolic changes that happens in your body at that fast pace. So you need to give your body the time and space to adapt to certain changes. So that is a very much important thing. So I would say slow and steady wins the race. And what is the optimal weight that needs to be kept? So we talk in terms of BMI. Okay, so we say it is a BMI, body mass index, of less than 25 kg per meter square. That is what we say. So a person who is about 5 feet, maybe 55 kg. A person who is 5.5 feet, maybe 60 kg. A person who is 6 feet plus, for him 70 kg is also appropriate. So it depends on your height, your body build, that you decide on an appropriate weight. Next. So now people come, what do I check? What are the blood tests I do want to check? So I always told you, do a urea, sugar, creatinine once in a year. But those who are diabetics, I don't say the same thing. So I would say for the diabetic patient, once in 3 months. So once in 3 months, please do your fasting, postprandial sugar, do a urea creatinine, and check your HbA1c level. If you are diabetics, can anybody say how many are diabetics here? Okay. So they know what is HbA1c, definitely. So basically that's the measure of how your sugar has been controlled for the last 3 months. So you do an HbA1c to see how your sugar is controlled. So the recommendation is very stiff. It says less than 7%, but it is not suitable for every age group. So as you grow old, your diabetic control should be less stringent, because if you try to control it very strictly, the chances is that you have complications due to low sugar and fall down. And you may sustain a fracture, you may fall down and sustain a fracture on your back. So, the control of sugar has to be emphasized as per age. So, a person who is young, less than 45, that is our definition of young. Please forgive me if I use that term like that. So, 45 years, the HbA1c target is 7. Around 60, it is 7.5. And more than 70, it is less than 8. So that is how we control the sugar. Next. So as I told you, the last thing emphasizes that less stringent control for persons who are elderly, who had a history of falls previously, who are not able to do daily routine activities without the help of a person, and those people who have serious memory issues, remembering things, elderly people, their sugar control should not be stringent. Rest all, you can advocate stringent blood sugar control. Next. Blood pressure is a common thing. So whenever I think so, here those who are diabetics would have blood pressure control. So blood pressure control is by certain specific agents. So you have drugs like telmisartan, olmesartan. Why we give that particular hypertensive agents is, it has an indirect effect of reducing your protein leakage in your urine. Sometimes people think, why this particular medications are given? These particular medications are given just to hinder the progression of your kidney disease if it is in the early stages. So this is the basic impact of giving these particular agents. Other antihypertensives are the choice of the particular treating physician. But this definitely is a part of your treatment regimen if you have early stages of kidney disease or you have a documented blood pressure. Next. So if you have cholesterol, what we target is something less than 200 milligrams per deciliter of serum cholesterol, or an HDL cholesterol. Many of them will be aware of these terminologies. Greater than 40, it is the aim. So we have something called statins, a particular group of drugs which we give to control the cholesterol level, because that is the target which we need to control to prevent further heart attacks, or to prevent future heart attacks, prevent future strokes and blockages in your lower limbs. Next slide, please. So these are the common drug medications that we use: metformin, insulin, glycosides, newer drugs which are kidney productive. I'll not go into the details. I will address those issues if you have doubts regarding these medicines when there's a Q&A. Next. So what do I want you as our church goers to do is basically definitely have an annual checkup. You're young, you are old, especially if you have a strong family history of diabetes, definitely do a yearly checkup. And if you have diabetic, please visit your doctor at least 3 monthly. At least if constraints are there, at least once in 6 months definitely. Those who are diabetics, please have a glucometer at home. You yourselves can monitor the sugar and alert the physicians. You did not go to the physician every time, because nowadays, at least from the Indian spectrum, you can easily access your diabetologist and you can consult them via phone or via audio. And have an eye checkup annually if you are a diabetic, and definitely do a urea creatinine and a urine routine examination as a minimum once in a year. Next slide, please. So I am open to any Q&A now. I am sorry that I did not speak in Malayalam because my fluency will be hindered. Sorry for that. But any questions in Malayalam, I will answer, no problem.
ഷുഗർ ടെസ്റ്റ് എടുക്കണമെന്ന് പറഞ്ഞല്ലോ,
ശരി.
അത് ഈ HbA1c ടെസ്റ്റ് തന്നെയാണോ എല്ലാവരും നിർബന്ധമായിട്ട് എടുക്കുന്നത്?
ഡയബറ്റിക് പേഷ്യൻസിന് HbA1c, നോൺ ഡയബറ്റിക് പേഷ്യൻ റാൻഡം ബ്ലഡ് ഷുഗർ ഈസ് ഇനഫ്.
ഇതിങ്ങനെ ബിഫോർ ഫുഡ് ആഫ്റ്റർ ഫുഡ് ഒക്കെ എല്ലാവരും എടുക്കണം?
അത് ഫാസ്റ്റിംഗ് ബ്ലഡ് ഷുഗറും പോസ്റ്റ് പ്രാൻഡിയൽ ബ്ലഡ് ഷുഗർ വി റിസർവ് ഓൺലി ഫോർ ഡയബറ്റിക് പേഷ്യൻസ്. Random blood sugar is enough for patients. Only when we have a suspicion, we will think of evaluating you.
Cholesterolum, sugarum, any relation is there? And they will develop side by side, I heard that.
Yeah. So, cholesterol and sugar. Okay. So, as I told you, diabetes is not only a problem of sugar. So, anything which has a problem with sugar control automatically has a problem with cholesterol synthesis. That is why majority of the diabetics will have a cholesterol problem by default, because their pathways, because I'm a doctor, I'm telling you, their pathways are interlinked. So definitely any patient of diabetes for at least 5 years, you will definitely have a cholesterol problem.
First of all, thank you very much for this session, doctor. 3 question ഉണ്ട്. അതിൽ first question, foods that cannot be taken, milk ഉണ്ടായിരുന്നെന്ന് തോന്നുന്നു അല്ലേ?
എന്തായിരുന്നു?
Milk.
Okay. So the problem, okay, so there are 2 types of milks you would have seen. Something is called as skimmed milk, they have written, and the normal milk. Okay, this data is basically Western data. I told you that when I said finally that dietary restrictions, I do not talk about skimmed milk and normal milk. So the thing about milk is the predominant sugar is lactose in that. So long-standing diabetic patients, they will have some amount of lactose intolerance. So there is an enzyme in our body. Why some people don't tolerate milk is there is an enzyme in your intestine called as lactase. So when you are long-standing diabetics, that enzyme comes down low and you are not able to tolerate milk. But if you say, is it a contraindication? Means you are not supposed to take milk? No. It depends on your tolerability to take milk, because when you are diabetic, that enzyme level comes down, that sugar, that complex sugar that is there in milk cannot be broken down effectively, and that may spike the sugar. So it depends on your tolerability, whether that enzyme is present, and your sugar control as a whole, to determine what quantity of milk you can take.
Okay, so
Skim milk.
so taking milk is not a problem. Lactose intolerant ആയിട്ടുള്ള
Yes,
ആൾക്കാർക്ക്
yes,
കഴിക്കാൻ പാടില്ല.
yes, yes.
Okay. Second, ഈ റെഡ് മീറ്റിനെ കുറിച്ച് പറഞ്ഞല്ലോ. അപ്പോൾ റെഡ് മീറ്റ് എന്ന് പറയുന്നത് ഉദ്ദേശിക്കുന്നത് ബീഫും മട്ടനും ആണ്.
Beef, mutton, pork.
ഓക്കെ. പിന്നെ മൂന്നാമത്തേത്, ഈ സീനിയർ ആയിട്ടുള്ള ആൾക്കാർക്ക് എക്സസൈസ് ചെയ്യാൻ വേണ്ടി ബ്രിസ്ക് വാക്ക് നമ്മൾ പറയുന്നു. പക്ഷേ അവർക്ക് മോസ്റ്റ്ലി ഈ ന്യൂറോ പ്രോബ്ലം ഉള്ളതുകൊണ്ട് ഈ മുട്ടൊക്കെ വേദന.
That is what I say. So what I would say is something called as isometric exercise. What I mean by isometric exercise is you can have a treadmill or a small bicycler at home, which you can do it at home where they cannot move much, because that can be only done for those. But I expect them to do 30 minutes. So that's what I told you. Definitely diabetics, elderly patients may have osteoarthritis. Telling them to do brisk walking is not sensible at all. So you can do whatever is possible within your health ability. So it may be, if you can take dumbbells and do it that. If you can have a bicycler at home, do that. If you are able to do a treadmill, just walk on the treadmill, do that. So every time I cannot advocate brisk walking, which is definitely a problem with elderly population. That's why in the earlier I told you, whatever is feasible as per your health, you should do. But 30 minutes a day.
What are the precautions that we have to take so that we don't go into a low sugar and the consequences of it?
Okay. So the most important thing is to take your food on time. So, first thing, two things before I answer that question. You said low sugar, right? So, first, you should ensure you don't have a kidney problem, okay? Because majority of the medicines, I am talking about the oral medicines which you are taking, are thrown out of your body by the kidney. So, if for some reason, in the due course of time, when you are taking sugar medicines, the same dose you are taking for quite a long period of time, and the same daily routine you are taking, same meal, same timing, you are very strict in your diet, and you start developing kidney issues, you start developing low sugar, think that you have started developing a kidney problem. This is one thing I want to emphasize, because majority of the patients, when I encounter kidney problem, they actually came to me with a low sugar, and they were very happy with their sugar control. For example, when you started off your treatment, let us assume you are a diabetic, you started off your treatment with some 2 tablets, and you were always at the range of 300 at sugar, your sugar was never controlled. One fine morning after 2 years, you realize your sugar is less than 200, don't be happy about it. Definitely you have a kidney problem. Because whatever tablets you have taken inside, they are not thrown out by the kidney effectively, and that's why your sugar has come down. So this is something which our people, it is due to lack of awareness. You don't meet your nephrologist on a daily basis, right? So that thing has to be made aware that you are taking those 2 tablets, you are following the same diet, but now you have come with a well-controlled sugar for 2 years. That means your kidneys are not doing good. So this is one thing. And now in a general perspective, so you want to control your sugar, your diet has to be fixed. Means whatever, if it's associated with your daily routine activities, your job activities, you have to determine the time. That is the challenge which working professionals face, not the elderly population face. Working professionals are not able to fix their dietary patterns, because majority of the people here are IT professionals. They will have a lot of work logs. They are not able to concentrate on their dietary patterns. You have to fix your dietary pattern, and that is the biggest challenge that you will face. Second thing is, you time your medications. For example, certain tablets have to be taken 30 minutes before food. Certain tablets have to be taken with food. Certain tablets have to be taken after food. Okay. Third thing, when you are about to regarding sugar control and low sugar, is to have a self-awareness and monitoring. I mean, that's why I said, when especially population or elderly, which are more prone to get low sugar, you should have a glucometer at home. Why? Because insulin, for example, majority of the elderly population will be taking insulin for their treatment. If you find that your sugar is slightly towards the lower end than the usual, you can always reduce 2 units of insulin from your night dose or morning dose, thereby preventing complications. This can be easily adjusted at home. In the Western countries, you can't meet your doctor like you meet your doctor in India. You have to wait 2 months, 3 months to meet a particular specialist, and maybe a year or so to make a super specialist. So we have actually insulin charts with us. Well, ready-made, patient-tailored insulin charts will be there, which will advise you how much insulin you have to take at a particular sugar level. So I advise I told you now, I deal with a mixed bag of population, one which comes from the lower socio-economic strata, educated and a higher social. I advise the educated and the higher socio-economic strata to take that chart which has the sugar control. How much insulin to be given at a particular sugar level. You yourself can adjust and prevent such low sugar catastrophes at home, at your workplace. So this is one of the few measures you can take as an individual, rather than meeting your doctor immediately, so as to get an optimal sugar control.
Hello, doctor. Doctor, ഈ ഫ്രൂട്ട്സിൻ്റെ കാര്യം പറഞ്ഞിരുന്നില്ലേ? So there is glucose is there, and അതുപോലെ തന്നെ fructose എന്നൊരു സംഭവമുണ്ട്.
Yes.
So ഈ fructose-ൻ്റെ intake, how will it affect diabetes? And natural alternatives of sugar. Doctor, alternatives of sugar പറഞ്ഞിരുന്നു. അപ്പോൾ natural alternatives of sugar like stevia.
What do you want? What do you have in mind as natural alternatives?
Natural alternatives is stevia, like things like stevia leaves. So these are natural alternatives for the regular sugar.
Okay.
സോ അത് വെച്ചിട്ട് നമ്മൾ കോമ്പൻസേറ്റ് ചെയ്യാൻ പറ്റുമോ? ഇപ്പം നിറയെ ഓൾട്ടർനേറ്റീവ്സ് ആർ ദെയർ, ലൈക്ക് നാച്ചുറൽ ഓൾട്ടർനേറ്റീവ്സ്. There are cake shops which offer natural based sugar cakes. So angana craving ullavarku once in a while if they have it, what will be the impact on their diabetics? Basically I want to know whether fructose will impact the diabetes.
Okay.
And natural alternative, will it be beneficial?
Okay. I'll answer the second part very scientifically. And the first part you said about fructose, okay. So all the sugars by environmentally they have the sugar called as fructose. So this fructose is a complex carbohydrate. So when it goes inside, definitely the end point of any metabolic byproduct in our body is glucose, because the brain, the heart and all important organs in our body can only use glucose as a source of energy. So anything which contains fructose will have to be broken down into glucose. This is one thing. Second thing, what are the things which actually will be beneficial? I was talking about fruits which have a low glycemic index. Food which has a low glycemic index. So among the apple and guava are the least foods with low glycemic index. Why I say? Not that the fructose is not there in that fruit. It is accompanied by fiber. So the point is, when you have a degradation of fructose which takes place on a later date because of the fibrous content, the spiking of sugar will be relaxed because of the consumption of these fruits compared to the fruits where fibrous content is less. So in patients who are diabetic, I would suggest to take fruits which fructose I cannot avoid because that's a natural constituent. Fruits which are rich in fibers. Okay, this is one thing. So fructose has to be broken down in your body, metabolized to glucose. This you cannot control, but I can advocate to take fruits which are rich in fibers so as to prevent the ready availability of fructose to be broken down into glucose so as to spike the sugar. Second thing, you asked about natural sweeteners and normal sugar. That is what you are talking about. Okay. Worldwide, the research tells you that it is not the absolute sugar level that is responsible for these complications. I listed 6 complications. It is actually the variability of the sugar control that is responsible for the complications. So the idea is to actually prevent swings of sugar rather than getting the optimal sugar control. So I would say, if the aim is to prevent, if normal sugar or natural sweeteners or natural sugar alternatives, the aim is to prevent the variability of sugar swings rather than the absolute, anything is feasible. Because the complication due to diabetes is dependent on the variability of sugar and not on the absolute value. Like 250 is not responsible for complication. It is actually how long you are being well controlled is the thing which determines whether you develop complications. If by your dietary pattern or if you take natural sweeteners as alternatives, you are able to attain that target, you can use it. But not the artificial sweeteners or the preservatives. That is the only context. So I don't advocate that you take sugar or natural alternatives. I say, think about what you want with that particular food material or a sweetener. What is your target? You have to prevent variability or spiking of sugars. If you can attain it by your natural in a better manner compared to your normal native sugar, please go ahead.
Thank you, Doctor.
ഡോക്ടറെ, ഒരു ഡൗട്ട് ചോദിക്കാൻ. ഈ ഡയബറ്റിക് ന്യൂറോപ്പതി ഉള്ളവർ കാണേണ്ടത് ഡയബറ്റോളജിസ്റ്റിനെയാണോ അതോ ന്യൂറോളജിസ്റ്റിനെ തന്നെ പോയി കാണുന്നതാണോ നല്ലത്?
I prefer initial visit should be with any MD physician. And definitely if neuropathy are the diagnosed, we have to diagnose by something called as an NCS study, nerve conduction study. He has to meet a neurologist because subtle signs, subtle earlier stage like some joint. So the earliest signs of diabetic neuropathy, I say, is difficulty in distinguishing between hot and cold. There is even a very minor subtle sign like joint sense, position sense. These are very subtle signs or early signs of diabetic neuropathy. That cannot be done by a MD physician sitting who is seeing multiple number of patients. He does not have the time and space to evaluate that much. So in that context, I would say a neurologist is better. Whenever a diabetic patient tells, I have tingling sensation, numbness of the soles of the foot, some new onset imbalance, I would suggest it is better to go ahead with a neurologist so that he diagnoses it faster and gives you the necessary advice. Acha, regarding diabetic neuropathy, I have to tell you one thing. It is a very dangerous and irreversible thing. At least diabetic kidney point of view, in the early stages, I can say something. Diabetic neuropathy is one complication where you don't get satisfactory returns to the patient. So at least in the earlier stages, what the doctor tries to do is adjust your lifestyle, give you preventive advice, and prevent catastrophic complications. He cannot direct the course drastically. But in terms of the eye and the kidney, if you visit me early or if you visit an eye doctor at an early pattern, we can do something drastic about it. But in terms of neuropathy, the truth is that we do not change any drastic returns we don't get in terms. We can only advise you to prevent some complications. That's all that comes from the medical perspective.
Second question, diabetic symptoms illade thanne kidney affect aguna prashnaങ്ങളുണ്ടോ?
Yes, that is what I told, that you may not have diabetes as a cause of kidney disease, one thing. Yearly you should make it mandatory, because now recently this phenomenon I'm seeing for the past 2 years, I have actually kids to adolescents coming with chronic kidney disease, okay, and that has nothing to do with diabetes or blood pressure as such. Whenever I do the scanning of that patient, I feel the kidneys are already small. This is because I think our belt from, we are doing research actually, we are trying to find out, the belt from Kanchipuram, Chengalpet and all has some mineral issues with water or some dietary patterns which due to which their kidneys shrunk in the due course of time. And we are trying to find out more evidence regarding that. That has nothing to do with your diabetes and nothing to do with your blood pressure at all. So I would advocate, even if you're young, healthy, well-built, doing good in your life, kindly do a urea creatinine. That's the basic, and a urine routine once in a year. Because diabetes is not the only cause of kidney disease. There are multiple other causes unidentified. Because just doing these 2 tests will identify the early onset of kidney disease, and you can visit your nearby kidney doctor to evaluate.
The test is urine routine.
Urine routine. There will be a column called as albumin, protein. So they will say 1+, 2+, 3+. So normally it should be less than 1+, sir.
Thank you, doctor. ഇപ്പോൾ ഇനി എന്തെങ്കിലും ക്വസ്റ്റ്യൻസ് ഉണ്ടോ ആർക്കെങ്കിലും? ഇല്ലെങ്കിൽ ഇപ്പോൾ വോട്ട് ഓഫ് താങ്ക്സ്.
Thank you for a patient hearing. I think it was a long winding lecture, but I was very happy that you participated in it and asked questions, and I hope so I justified my lecture. So thank you very much for giving me this opportunity.
ദൈവനാമത്തിന് മഹത്വം ഉണ്ടാകട്ടെ. നമ്മുടെ യങ് കപ്പിൾസിൻ്റെ ഫെലോഷിപ്പിൻ്റെ 2nd മീറ്റിംഗ് ഇവിടെ ഒത്തുകൂടുവാൻ തന്ന ദൈവകൃപയ്ക്കായിട്ട് നന്ദിയോടെ സ്തോത്രം. ഇന്ന് ലാസ്റ്റ് ഈ യങ് കപ്പിൾസ് മീറ്റിംഗ് നമ്മൾ കൂടിയപ്പോൾ അച്ഛനാണ് സജസ്റ്റ് ചെയ്തത്, ഇറ്റ് നീഡ് നോട്ട് ബി ബൈബിൾ സ്റ്റഡി ഓൾവേസ്, ജനറൽ ടോപ്പിക്സ് ഡിസ്കഷനും ആവാം. അങ്ങനെ അച്ഛൻ്റെ നിർദ്ദേശപ്രകാരമാണ് ഇങ്ങനെയുള്ള സെഷൻസ് നമ്മൾ ആരംഭിച്ചത്. അച്ഛൻ നമുക്ക് നൽകിക്കൊണ്ടിരിക്കുന്ന നേതൃത്വത്തിനും ഗൈഡൻസിനുമായി അച്ഛന് പ്രത്യേകം നന്ദി പറയുന്നു. അതുപോലെ ഇന്ന് നമ്മൾ വളരെ യൂസ്ഫുൾ ആയിട്ടുള്ളൊരു സെഷനാണ് അറ്റൻഡ് ചെയ്തത്, അല്ലേ? ഡയബറ്റിക്സ് ഒരു സാധാരണ ഡിസീസായിട്ടാണ് നമ്മൾ കൺസിഡർ ചെയ്തിരുന്നത്, ബട്ട് ഇറ്റ് ഈസ് കണക്റ്റഡ് വിത്ത് ലോട്ട് ഓഫ് അതർ ഓർഗൻസ് ആസ് വെൽ. ഡോക്ടർ നമ്മൾക്ക് പറഞ്ഞ് മനസ്സിലാക്കി തന്നു. ഇത്രയും ഉപകാരപ്രദമായ ഒരു സെഷൻ നമുക്ക് വേണ്ടി ഒരുക്കിയ ഡോക്ടർക്ക് EMTC യങ് കപ്പിൾസിൻ്റെ പേരിലുള്ള പ്രത്യേകമായിട്ടുള്ള നന്ദി അറിയിച്ചുകൊള്ളുന്നു. അതുപോലെ തന്നെ ഇത്രയും നേരം ഇതിനുവേണ്ടി മാറ്റിവെച്ച് അറ്റൻഡ് ചെയ്ത ഇടവക ജനങ്ങളോടുള്ള പ്രത്യേകമായിട്ടുള്ള നന്ദി അറിയിച്ചുകൊള്ളുന്നു. ഇങ്ങനെ ഒരു സെഷൻ അറേഞ്ച് ചെയ്ത് EMTC യങ് കപ്പിൾസിൻ്റെ എല്ലാ ഭാരവാഹികളോടുള്ള നന്ദിയും അറിയിച്ചുകൊണ്ട് എൻ്റെ വാക്കുകൾ ചുരുക്കുന്നു. വന്നിട്ടുള്ള എല്ലാവർക്കും സ്നാക്സും റിഫ്രഷ്മെൻറ്റ്സും അറേഞ്ച് ചെയ്തിട്ടുണ്ട്. എല്ലാവരും പങ്കുചേരണമെന്ന്.
താങ്ക് യു. നമുക്ക് പ്രാർത്ഥിക്കാം. ദൈവമേ, ഞങ്ങളുടെ സ്വർഗീയ പിതാവേ, ഞങ്ങളുടെ പ്രിയ ഡോക്ടറിലൂടെ ഞങ്ങൾക്ക് വേണ്ട അറിവ് അവിടുന്ന് ഞങ്ങൾക്ക് തന്നല്ലോ. കർത്താവേ, ദൈവം ഞങ്ങൾക്ക് തന്നിരിക്കുന്ന ആരോഗ്യത്തെ ഞങ്ങൾ സംരക്ഷിക്കേണ്ട ഉത്തരവാദിത്വം ഞങ്ങൾക്കുണ്ടല്ലോ. ഞങ്ങളുടെ ഭക്ഷണ കാര്യങ്ങളിൽ ക്രമീകരണം ചെയ്യുവാൻ, ആവശ്യമെന്തെന്ന് അറിഞ്ഞ് അത് ഞങ്ങളുടെ ശരീരത്തിന് നൽകുവാൻ വേണ്ട കൃപ ഞങ്ങൾക്ക് നൽകണമേ. കർത്താവെ, രോഗാവസ്ഥയിലിരിക്കുന്നവർക്ക് വേണ്ടിയൊക്കെ ഞങ്ങൾ പ്രാർത്ഥിക്കുന്നു. ദൈവമേ, രോഗത്തിൻ്റെ അനുഭവങ്ങളുടെ മധ്യത്തിൽ നിരാശപ്പെട്ടു പോകാതെ കർത്താവെ, ഡോക്ടേഴ്സിലൂടെ ഒക്കെ പ്രവർത്തിക്കുന്ന ദൈവത്തിൻ്റെ കൃപയെ അനുഭവിച്ചറിയുവാൻ അവിടുന്ന് അവരെ സഹായിക്കണമേ. ഞങ്ങളുടെ പ്രിയ ഡോക്ടർ ജെറിക്കായി ഞങ്ങൾ സ്തോത്രം ചെയ്യുന്നു. നിൻ്റെ മകനെ തുടർന്നും അനേക രോഗികൾക്ക് സൗഖ്യത്തിന് കാരണമായിട്ട് അവിടുന്ന് എടുത്ത് ഉപയോഗിക്കണമേ. അനേക രോഗികൾക്ക് നിൻ്റെ മകനിലൂടെ സൗഖ്യം പ്രാപിപ്പാനിടയാക്കണമേ. അറിവില്ലാതിരിക്കുന്നവർക്ക് ഈ അറിവ് പകർന്നു നൽകുവാൻ നിൻ്റെ മകനെ എടുത്ത് ഉപയോഗിക്കണമേ. കുടുംബമായിട്ട് വാഴ്ത്തണമേ, അനുഗ്രഹിക്കണമേ. പ്രത്യേകിച്ച് കർത്താവെ, ഭവനത്തിലായിരിക്കുന്ന വൈഫിൻ്റെ പിതാവിന് വേണ്ടി പ്രാർത്ഥിക്കുന്നു. നിൻ്റെ കൃപ നിൻ്റെ ദാസന് നൽകണമേ. ഞങ്ങളെല്ലാവരെയും അവിടുത്തെ കരങ്ങളിലേക്ക് ഏൽപ്പിക്കുന്നു. അങ്ങയുടെ ആലോചനയാൽ ഞങ്ങളെ നയിക്കണമേ. കർത്താവെ, യങ് കപ്പിൾസിനായി സ്തോത്രം. കർത്താവെ, ഞങ്ങളുടെ ഇടവകയ്ക്ക്, ദേശത്തിന് വേണ്ട നിർദ്ദേശം നൽകുവാൻ, ഗൈഡൻസ് നൽകുവാൻ, കർത്താവെ, വേണ്ട ഡയറക്ഷൻ നൽകുവാൻ തക്കവണ്ണം ഈ സംഘടനയെ എടുത്ത് ഉപയോഗിക്കണമേ. ഇന്ന് മീറ്റിങ്ങിൽ പങ്കെടുത്ത എല്ലാവരെയും അനുഗ്രഹിക്കണമേ. യേശുവിൻ നാമത്തിൽ ഞങ്ങളുടെ പ്രാർത്ഥന കേൾക്കുമാറാകണമേ. കർത്താവേ, യേശുമിശിഹായുടെ കൃപയും അനുഗ്രഹങ്ങളും വാഴുകളും പ്രിയരെ നമ്മോടും നമ്മുടെ ജീവിതത്തിൻ്റെ എല്ലാ പ്രവർത്തനങ്ങളോടും ആവശ്യങ്ങളോടും ഇപ്പോഴും എന്നേക്കും ഉണ്ടായിരിക്കുമാറാകട്ടെ. താങ്ക് യു. ഒരിക്കൽ കൂടി ഡോക്ടർക്കും എല്ലാ പ്രിയപ്പെട്ടവർക്കും നന്ദി.